Consortium of patient advocacy groups, including SLC 6A1 Connect.
Hello, I'm Jacob Tiller, the Chief Scientific Officer of SLC 6A1 Connect, and today we'll be discussing the SLC 6A1 neurodevelopmental disorder standard of care development. So what is a standard of care? Well, broadly, a standard of care defines appropriate procedures for treatment for the various domains of the condition and seeks to establish clinical guidelines. We also seek to ensure that each SLC 6A1 patient experiencing symptoms receives adequate and proper care. Additionally, a standard of care is defined by a set of key characteristics. These include an evidence-based approach, collaboration with providers, and a patient-centered final product. A standard of care is vital, as to date, over 100 individuals have been found to have a pathogenic variant in the SLC6A1 gene, according to a 2020 study conducted by Dr. Goodspeed. Progress to date. A holistic process involving a literature review has been used. Following this review of all relevant publications, we crafted clinical outlines for the 17 symptomatic domains of SLC6A1. These will be reviewed by providers for feedback and ultimately culminate in the final publication. The first step was this comprehensive literature review, which included 46 papers. We then moved to write outlines for 17 domains, and then finally sent these to 30 providers for feedback.
So what are those 17 domains for this publication? This includes neurological issues and EEG and seizure abnormalities, but it also includes domains such as emotional or behavioral problems that patients may have, or motor difficulties, as well as how all of these symptoms impact an individual's day-to-day life and their ability to socialize and be members of their community, as well as how all of these issues and symptoms of the patient can impact the caregiver. So the methodology for how we're doing this standard of care is we began with a thorough literature review where we searched for SLC 6A1 and looked through all of those publications for mentions of symptoms and how those symptoms are being managed. Then our next step was to draft outlines using this literature review in order to determine what symptoms are currently known for each of those domains, how those symptoms are assessed and diagnosed, and what treatments or potentially lack of treatments are there for each of these symptoms. Well, now that we have drafted these outlines, we are sending them out to clinicians and therapists and any other providers. So we will be needing a lot of participation from the professional community for SLC 6A1. If you have not heard from us already, then please be looking for an email, as we would welcome support from all of you. Once we receive your feedback, we will then incorporate it into the final draft, which will then be submitted for publication. So the goals of this project are to create a standardized protocol so that when clinicians see an SLC 6A1 patient, which may be the first time they have ever met someone with a mutation in this gene, then clinicians will have a published set of guidelines that they can refer to help guide their care. This is vital to ensure that everyone with a rare disease like SLC 6A1 gets the proper treatment they deserve. And then this is also important for collaboration and allowing researchers to all be using the same protocol. So thank you to all of the families who have participated in research projects so far that have allowed us to have such a thorough literature base to pull from. And then thank you to all of the professionals who have contributed so far, as well as those who will be contributing.